At Smith Chiropractic, it's not one-size-fits-all care. We're going behind the scenes to explore the range of non-surgical therapies used to treat pain, improve mobility, and support healing. Take a look. Pain doesn't look the same for everyone, so the treatment shouldn't either. And today we're getting a tour of Smith Chiropractic to show off some different kinds of non-surgical therapies that are helping patients find relief. I'm joined now with Dr. Jacobson as he's going to be showing us around. Good morning.
Good morning.
So we are now currently in the examination room. So what happens here? This is kind of where it all starts, Doc.
Yeah, this is where we'll start you when we come in to see us initially. And so what we do in this room is a very thorough consultation, which means you and I have a conversation about your problem so we can accurately see what you've been through. Once we're real time, we do examinations, and what that means is I'm going to watch you move. I'm going to do what are called orthopedic tests to stress structures and test your nervous system to make sure we got an accurate look at what that is. And then commonly we're going to take a look inside your body, which is X-ray. And then in our facility we do digital X-ray, which is the most advanced there is. So it's a low radiation exposure, but it allows me to accurately see inside your body so I can accurately diagnose your condition and then recommend the proper treatment after that. First and foremost is spinal decompression, and what that is, it's this table here, and what you do is we're either going to be focused on the neck, which is cervical spine, or your low back, which is lumbar, but essentially you'll lay on the table and we're going to create space in your spine. And so it's essentially taking that part of your spine and gapping it open. In particular, this is going to create space where there's degeneration like arthritis. It's going to take pressure off of the discs and the nerves. And so we're commonly use this for disc problems and arthritic disorders, which is like wear and tear. And so one of our great therapies there that we'll recommend.
That's a tried and true therapy too, right?
It's tried and true. It's been around a long time, and it'll continue being there because it does the job it needs to. Yeah. Shockwave, which I've always been excited about shockwave just because of the results that we can get. But what shockwave is, it's a mechanical wave. If you've had ultrasound, it would be in that family, but it's intensive sound bursts that stimulate your body to heal. We use it for tendinous and ligamentous injuries. Classic would be like tennis elbow or plantar fasciitis, very stubborn conditions that people deal with over time, but allows us to essentially heal that area, so it's not just a temporary fix, but really getting lasting relief over time and really changing that condition. So we're very excited about shockwave and the way we use that.
When I hear shock, though, that's not going to hurt me, right?
The results are shocking. Really good for me. It's appropriately named if you had the therapy. Just to show, this is one of our chiropractic adjusting rooms. So this is where we adjust or manipulate the spine, which is essentially putting movement in areas that don't work like they should. And what comes along with this is your posture, how you bend and move, but is the basis of all the treatment we do, where we start with chiropractic and then add on top of that. But that is one of the rooms that we do that in, yes. Next on the stop would be Class 4 laser therapy. And just for context, laser therapy can go as high as a Class 5, which would be surgical, which we're not doing here. But Class 4 is still very powerful. Can penetrate 8 to 12 centimeters into the body, which is the distance. Tells you to grow blood vessels, tells your cells to ramp up in energy, tells you to create nerves, blood vessels, and even grows cartilage. And so that's something we use to bolster the healing effect in conjunction with the other therapies that we're doing. But love our Class 4 laser therapy.
You can't forget your office, Doc.
Oh, yeah, let's talk about my office here. And so this is just another place where, once again, we're going to accurately diagnose your condition and then effectively communicate what we're going to do to help you, which we do in here, which you'll sit across from me doing. We also treat a condition known as peripheral neuropathy. And what that means, it's a breakdown in the nerves, has to do with blood flow. Yeah. And it's a conservative treatment for something that's usually just left and degenerates over time.
And I did notice you've kind of got a little gong here in this.
Yeah, just a fun thing. You know, something I always wanted to celebrate with the patient. And so this is a proclamation of improvement. So when you come in and you've achieved the result you're looking for, and that just doesn't mean relief of pain, but back to activity, which can mean I was able to sit in the bleachers and watch my kids' game. Yeah. I was able to walk around the block. You know, I went up the incline, anything in between, but it's a external proclamation of your improvement. Just kind of a fun thing we do here, yeah. Next on the stop is massage therapy, which in the office we call manual therapy, which is a term makes a distinction where it's not just a short-term effect, it has a longer lasting effect where it's working on trigger points, tight muscles, allows blood flow. Really a fundamental part of this. I couldn't be able to get the improvement that I do without my good massage therapist, but you will feel it when they work on you. I like to joke and say you'll speak in tongues, but after you'll like them more than you like them. Yes, absolutely.
So, Doc, are you guys taking patients right now for some of these therapies?
Absolutely. We're always looking for more patients to help. You know, there's a lot of pain in the world, fortunately or unfortunately. But yeah, we are currently taking patients. Yes.
And what's the easiest way for them to get in contact with you?
You know,
the phone's ringing now.
Yeah,
so
same. It's just you just got to call the office, and we just find a spot for you to put you through this process. We're doing a special for Fox 21, which is just a $39 fee for the first examination, consultation, X-rays, and then your first treatment. We do recommend treatment beyond that, but that's something we are offering to Fox 21 viewers. Yeah.
When they mention this segment?
When they mention this segment, yes.
Wonderful. Well, Doc, thank you so much for having us, showing us around. If you're interested in maybe some non-surgical therapies to help you find some pain relief, make sure you give Smith Chiropractic a call, and make sure you mention Fox 21 and Loving Living Local so you can get that special deal right here in Southern Colorado. Smith Chiropractic offers non-surgical drug-free therapies designed to help patients feel better, move better, and heal better. For more information, visit the website you see right there on your screen. This segment has been sponsored by Smith Chiropractic.